In mid-October, I had an opportunity to participate in the HLTH, commonly known as the Health Conference, which is held in Las Vegas, Nevada. Well, this conference attracts thousands of people in the healthcare industry. It focuses a lot on using tech to facilitate wellness. And I was there to talk about our nutrition portfolio. And I think our nutrition agenda is really important for people in healthcare to understand. They are an incredibly important, not just community for us to be talking to, but also a messenger for our messages related to nutrition. And so I think it's really important for us to be talking to the healthcare community because that is where so many people get their information related to their health and well-being. So if we're not talking about our efforts to reduce diet-related chronic disease to the healthcare community, I'm not sure who is. But I also had the opportunity to participate in 3 different podcasts. These all had an audience that was generally related to the medical community, all with an interest in nutrition. So hopefully reaching an audience that we may not otherwise reach in our normal channels here. There is a lot of opportunity to work with private sector entities who have an interest in the health and well-being of their customers in pursuing our nutrition agenda because it lines up with fundamentally what they want for their customers, which is for their customers to live healthy lives. I think we've really just begun to scratch the surface, and I really look forward to working with any and all in civil society who want to partner with us on our common nutrition related goals. Some of the work that we're doing with public-private partnerships, if we're not talking about it, nobody's going to know about it. And we're interested in working with a lot of different private sector entities. But again, if no one knows that this is something that we're willing to explore, then the number of opportunities we have is going to be less because people aren't going to know, you know what, I think I'll give the foods program at FDA a call because they seem interested in doing this kind of work. So I think it's important to talk about things that you're doing, especially if they're somewhat new and innovative. And Kroger has begun to implement a process whereby they actually rate the nutritiousness of the foods that they are selling, and they make this information available electronically. The idea that they are actually looking at the nutritiousness of the products that they sell in their store, I think is going to have profound positive impacts on ultimately what is offered in their store, and hopefully we'll see that play out in benefits to their customers. So you may be surprised to know, but our nutrition team here in the Human Foods program is working with Instacart on a partnership whereby the information that we have related to the healthfulness of foods they can have access to so that their customers are able to make easier choices associated with the healthfulness of the foods that they are purchasing through Instacart. Again, I think that opportunity is pretty profound, and I'm very interested in pursuing it. It was also not surprising that, as we've seen in our relationship with Instacart, is that we can take advantage of some of the tech tools that are becoming available to facilitate our agenda, which is helping people have more nutrition information that allows them to make better choices about what foods they eat. Join me next time as I travel to a school in the Washington, D.C. area with my counterparts from the United States Department of Agriculture as we talk about the importance of nutrition in public school meals.